Danger might not be the first thing you think of when you hear hyperopia, but I'm going to talk about a few things that you may not know about that could affect you if you or a loved one has hyperopia. It's always my goal to inform and encourage people to learn more about their health so that they can help to prevent possible issues in the future and have greater confidence talking to their doctors about concerns about their eyes. Routine or annual eye exams are always a great idea to catch problems before they escalate. Now, these dangers may not apply to everyone, and they tend to affect people with higher levels of hyperopia, but they'll help you to know what to look out for in yourself and in your children and other loved ones. It's especially important to look out for children because they don't know that they have a visual problem. They've never experienced vision or life before. So it's our job to check in on them and make sure that they don't have any issues that could cause problems in the future. So let's get into it. The cause of hyperopia is when the cornea is too thin or the axial length of the eye is too short and the light gets focused behind the retina where it's supposed to land to give you clear vision. So some people think of this as the eye not being strong enough. So we need to add power with glasses or contacts to focus the light properly on the retina to give good vision. But how could this actually cause a medical problem? Well, for one, people could go undiagnosed or untreated for hyperopia for a long time, sometimes up to about half of their lifetime. Because when we're young, our eyes are able to focus. See, what happens in hyperopia, which is also called far-sightedness, is that people with hyperopia struggle to see more at near than they do at distance. But sometimes people with hyperopia don't notice that they struggle to see at all. And that's because of how our eye functions when we're young. So let's break this down a little bit. If our eyes had perfect vision at far distance, no matter what, when we bring things in closer, the lens of the eye needs to focus to see things clearly up close. With someone who has hyperopia, their vision at distance is already affected. So their lens is having to focus at far distance all of the time. And then when they focus at near, it has to focus even that much more. So this is why people with hyperopia tend to have near complaints, or eye fatigue, eye strain, headaches, with lots of near work. And sometimes they may have these symptoms at far distance as well. And if their prescription is very high, they may have blurry vision at all distances. Of course, much worse at near than it is at distance. So one of the reasons this could be dangerous is that someone's quality of life could be significantly affected for a really long time before they're actually diagnosed with an issue. Hopefully, if people go to the doctor and say they have headaches, they'll be referred to an eye care provider and have their vision checked. Because if their prescription is mild enough, they may feel like they have clear vision all the time, but they're having this strain and this headache. So if they actually go to an eye doctor and have their eye dilated and tested, that dilation prevents the eye from focusing temporarily, so we actually get a measurement of what their prescription should be. And you may find that you need a prescription all of the time and that this eye strain fully goes away. I've had new patients come to me in their late 30s or 40s who are starting to have trouble more so at near, and we find that they've needed a prescription for far distance all this time, and they have this aha moment of, oh my goodness, that's why I'm always so uncomfortable. And once they get their glasses, it's like a whole new world for them, and it really does change their quality of life for the better having these corrective lenses. Amblyopia is a condition that I take very seriously, and in the case of hyperopia, it would affect those who have blurry vision at near and distance. Amblyopia happens when our brain doesn't have the visual stimulation that it needs in order to develop vision to its full potential. Because when we're born, our vision is not perfectly clear, and exposure to clear, sharp visual stimuli is what causes the neural connections in our brain to develop to help us to see clearly. So for a young child who has hyperopia and does not see clearly at any distance because their hyperopia is very high, these neural connections will not develop. And if this isn't corrected, hopefully before the age or well before the age of 7, and if amblyopia isn't treated, hopefully before the age of 10, these neural connections may never develop. That means if vision isn't corrected in time, even if you give someone with high hyperopia the perfect prescription that they need, they will not be able to see clearly because of the limitations of the brain's neural connections. This is very serious because it affects their vision for life, and the more severe the hyperopia is, the more it could affect their vision. This is the reason that it's so important to have eye exams starting at a young age, hopefully before the age of 1. Something else that can occur in patients with uncorrected hyperopia is strabismus, particularly accommodative esotropia, which is where the eyes turn in. When we focus up close, our eyes do 3 things. The lens changes shape to bend the light, the pupil gets smaller, and the eyes converge slightly. In these cases, the lens isn't able to focus enough to give clear vision at near, so the eyes begin to turn in. This is treatable with full-time use of glasses, and when the glasses are removed, the eyes will tend to continue to turn in, so that is why they are needed full-time. In the majority of cases, surgery isn't necessary because the glasses correct a condition fully. But if the eyes continue to turn in, even with the use of glasses, sometimes surgery may be helpful. In these cases, it's also important to monitor for amblyopia. Patients with such a high hyperopic prescription like this are more susceptible to the amblyopia that we discussed earlier. Another danger that people with hyperopia may face is the risk of angle closure glaucoma. Now, they're not at risk of glaucoma because they need glasses. They're at risk because of the simple differences in anatomy of the eye that someone with hyperopia has. Like we were discussing earlier, the eyes tend to be shorter in general, and so the components of the eye are generally more crowded. And for the eye to function properly, it has this fluid that moves through it, and the fluid needs to be produced, but it also needs to drain properly. If these components are smushed, the exit path for the fluid, which is in this tiny little angle between the back of the cornea and the front of the iris, it can be much smaller. Glaucoma isn't just about high eye pressure. What happens is the optic nerve gets damaged, and that causes peripheral vision loss. And it happens very slowly over time. This happens more so in primary angle closure glaucoma, where this small angle is causing enough of a strain and a pushback on the optic nerve that it's causing this slow loss of vision. But there's also a risk of a sudden event called acute angle closure glaucoma. In acute angle closure glaucoma, this angle gets blocked off very quickly and the pressure spikes extremely high, and people can lose vision within hours. And glaucoma causes irreversible vision loss. Symptoms of acute angle closure glaucoma would include severe pain in the eye, usually redness around the iris, halos around lights, nausea and vomiting sometimes, blurred vision, and a pupil that's kind of midway dilated and stuck in that position. People with acute angle closure glaucoma tend to know something is going on and they want to seek treatment immediately, and they very well should. In primary angle closure glaucoma, it's a little bit more insidious as it doesn't produce that many symptoms, just like other types of glaucoma. The peripheral vision loss is so slow that people don't notice it until often years and years down the road. So that's another reason it's important to get regular eye exams, have the eye pressure checked, and there are other things that the doctor will check as well. Those with primary angle closure glaucoma may experience intermittent halos around lights, especially going from dim situations to light situations, and this may happen over the course of years. They could be at greater risk for acute angle closure glaucoma as well. Treatment for primary angle closure glaucoma would be a peripheral iridotomy, where a laser is used to poke a little hole in the iris, or an iridectomy where a section of the iris is removed surgically, and that allows an alternate pathway for fluid to get through so it doesn't build up the pressure if that angle is too tight for it to exit through. And without that buildup of pressure, it won't push on the optic nerve, causing that peripheral vision loss and optic nerve damage. For acute angle closure glaucoma, it is best to treat it within a few hours, and that would be with topical eye drops. Sometimes oral medications are used. In really severe cases, maybe even IV medications, and to do an iridotomy as soon as possible to relieve that pressure and get it back to normal as fast as you can. The ultimate goal in both of these is to make sure there is an alternate pathway for the fluid to get through so it does not increase the eye pressure and push on that optic nerve. Usually if people have acute angle closure glaucoma, the doctor will recommend having an iridotomy on the other eye so that it doesn't occur over there as well, as there tends to be symmetry between the two eyes. If you have hyperopia, remember these things and be sure to see your doctor for routine eye exams. Help out a friend and send them this video. If they've been complaining about eye strain or other things like that, maybe they have hyperopia and they should get it checked out. So share the wealth of information, and I hope you found this helpful and that we'll see you next time. Thanks.